welcome to another episode of If It's in the Mind, It Can Be Managed, the Mind Management Mentors podcast. I'm Cuddy Cudworth, your illustrious host for this podcast. I love the Mind Management podcast because we're getting in conversations with apps. A lot of people say, "Could you've got a niche?" And I'm like, do you know what? There's too many conversations to be had to get the message out into so many different areas. So if we are niching, it's mindset and mental health. And Amanda, introduce yourself, tell us who you are, and then I'll explain why you're here.
So my name is Dr. Amanda Bassey Duke. I am a dentist in Perth, Scotland.
Amanda,
Lovely sunny Perth,
that's not the
Scotland.
Amanda I know. You do. That was your telephone voice. Amanda, you're not doing the podcast on your telephone voice. You are doing that raucous person I meet. And there it is. The flip of
Oh
the
God. Do you know what? So my name is Amanda Bassey Duke. I am a dentist. Well, I'm technically Dr. Amanda Bassey Duke because I have spent 5 very long years in university earning that title. I'm in very sunny and unusually very sunny Perthshire, Scotland. I've lived here now for 2 years. Love it. I work as a general dentist in a very nice practice here in Perth. 6 surgeries, 3 floors. We have all the mods, all the kits. I work with Clyde Monroe as an associate dentist. My areas of interest are restorative dentistry and cosmetic dentistry, and I do some orthodontic dentistry as well. I cater to just over 1,000 people within the Perthshire population, and I have people coming from far and wide just to come to the practice. So that's a little bit about me. I've done a lot of studying, a lot of added degrees just to get to where I am, and to have the skill set that I do. But I love my job. Wouldn't change it for a thing.
There's a few conversations we're going to have today. So the premise of today's podcast is
Yeah,
is mental health and suicide rates
yeah.
within the dentistry. So I remember watching a movie years ago with Matthew Perry and Bruce Willis.
Mhm.
And there was a joke on that movie that I didn't know was a fact. But the whole premise of that movie with Bruce Willis, I think it was the whole 9 yards, and Matthew Perry was the suicide rate in dentistry is one of the highest.
Mhm.
Is one of the highest in any business. I know farming's getting quite high as well for mental health and for suicide, but dentistry. And when we had that conversation at the networking meeting, I'm like, we need to talk about that. Why in dentistry is there a poor mental health and or possibly a high suicide rate within that business structure?
Um, at the moment, the current stats that we have says about 14% of dentists in the UK have contemplated suicide. 14%. And I think that number doesn't seem like a lot, but someone mentioned that that's the population of Crieff. The
That's the
population,
population of Crieff.
yes, that's the population of Crieff within the dental world has thought about committing suicide at some point or another. And that for me brought it to life. And I think if you speak to any dentist, they probably know somebody within their circles that have attempted suicide at one point or
Attempted or thought about it. There's two different ways of looking at that.
attempted.
Tempted, wow.
At some point, and that's a significant number of dentists. So it's quite shocking. If you ask me, and everyone will have a different theory, but I think it's a mix of high stress, high demand. It's quite a solitary role. And how many jobs can say that the first thing a patient ever says to you is, I hate coming to the dentist, or it's not personal, but I hate you and I hate what you do. And you hear that day in, day out for a job that is both mentally, physically, and emotionally tasking.
I
And
never even thought about that. I thought the first thing that someone was going to say was open wide, but that would be the dentist.
yeah, yeah. I hear that multiple times every day. It's funny because I was talking to an osteopath friend of mine the other day, and we'd had a session, and I was so grateful. And he said to me, and I was like, it must be so nice that people are so grateful to come and see you. And he burst out laughing because he knew exactly what I was talking about. People go to the osteopath because they're in pain, because they're in need. Although people come to the dentist because they're in pain, They have a very different mindset as to what we do to try to alleviate that pain. And it bears its toll on us.
Why is tooth pain so horrendous? It's so I know for I've got terrible teeth. We've had the conversations.
Mm.
I'm trying to hold on to the last six teeth that I've got. Everyone, Cuddy, you've got a really nice smile. You can actually literally, the teeth I've got there are the only ones I've got. Oh, right. And I know we're going through certain things because we'll have the conversation. We'll move into the conversation of the difference between going to Turkey and coming to see you, Amanda.
Yeah.
We'll have that as part of the podcast as well. But you make a really good point of the first thing someone's going to say when they come into that dentistry to see you, smiley Amanda, is, I don't like you. Can you just do it? That must be, and actually for a human being to have that much hate because of what you do, that actually must take its toll.
Oh yeah.
Genuinely, really must take its toll.
Oh yes, 100%. Because when you consider, and you have to understand that a lot of people decide that they want to do dentistry when they're teenagers. So you make a lifelong goal as a teenager. When you make that decision, you don't realize the other parts that come with doing that job. And no one tells you at 16 or 17 that you're going to work in a career that is incredibly solitary, that has one of the highest litigation rates at the moment, that has a dental council that is very biased towards the patient, and you could potentially lose that license, that comes with high debt depending on where you studied, that comes with just a high amount of dissatisfaction. So, and also the physical and emotional toll that it has on you, because I don't think I know a dentist that has not been for some form of physio, osteo, or massage just to get their body right, because we're punched over every single day. No one tells you all of this, right? And you walk into that okay occupation starry-eyed, and it slaps you in the face, and you're not given the tools. And bless, people are standing up now within the dental community, but at the time at which I graduated, I didn't have those tools. You're not given the tools to manage all of this. But then that's why we struggle.
Wow. Because everyone makes it about themselves when they come to the dentist, don't they? It's like my pain, my upset. So I used to have a really big phobia about dentists. So when I was, but
Where did
I
that
had
come
braces
from?
when I was a kid. Yeah. So when I was a kid, I had braces, and I had it done with the NHS. So there was like a training school. So I went there. So for 2, 3 years of having braces, I every month tightening up, I was in absolute purgatory, pain, horribleness. So through twenties. I went to 20s. When I got too thick, I was just right. So I did something, and I'll be open and honest. I had my tongue pierced, and every time I chomped on a burger, I cracked a tooth, and I was like, "Oh my god, the pain!" So I lost a lot of teeth because of the piercing that I had, and it got because I got such a fear of root canal surgery. I don't know where that's from. I had such a fear. I just started saying, just whip them out. Don't mend it. Just take it out. So that when I was living in Ibiza for a while, the dentist was like, "You sure we can save it?" I'm like, "No, just rip it out. I can't do with the pain of root canal surgery." Um, so I lost a few teeth through that, and then I also remember, I don't know why, but I started coming to my local dentist when I moved back home to the UK, and she knew how to fit. And I used to go into the dentist with high music on, so I didn't hear the drills and all those kind of things. And they got me through it. And now to the point, I love root canal surgery. It's one of my favorite things in the whole world. I'm like, yep, let's go. I'm loving it. I love the experience and I love the feeling. So I've had to work through that. So I've helped people go through all those things. So I get the fear. But coming back to an earlier question, why is toothache and abscess so painful? I mean, it's purgatory. The pain I've been told is as bad as childbirth for ladies.
So you have to understand, like the facial nerve's about here, right? It splits about here. Your teeth are just here. The distance it has to go to get to that, this is where it's the split happens. The distance it has to go to get to the nerve is not very far. So
And
that's
that's the reason it's a quick
yeah.
replay. If I've got a pain in my toe, the processing is a lot longer for it to up to the brain, but when it's just
Yeah.
there, connected straight in,
Yeah.
boom.
Yeah. That's
Wow.
right. And that's why. So it is. But what's like you said about root canal, there's a lot of misinformation as well. I remember this was pretty maybe about 5, 6 years ago in my career. I had a young guy come in, and he knew he needed a root canal. I'd explained the process to him, and he'd gone into work, and bless him, everyone said to him, "It's worse than death." He'd come in sweating and absolutely just wet with sweat. And he was so afraid. And I had a conversation with him. I reassured him. My nurse helped me to reassure him at the time. And we'd finished, and he was like, "Is that it?" But he was so afraid. Like you could feel the tension in the room. There is so much widespread misinformation. I'm sure one person had a bad experience somewhere. And
Yeah.
bad news travels a lot quicker than good news.
Yeah. Yeah.
So it's probably started with one person being, and again, we're there to try to alleviate pain, not to cause pain. I don't think anybody will go into healthcare to try to cause pain. The problem is a lot of people will forget the pain they were in before the root canal and associate that pain with the actual process of the
Associate.
root
Yeah.
canal. And then for them, root canals are painful. Taking teeth out are painful. No dentist, what their sauce just will take out a healthy tooth. We're taking out a tooth that was causing a problem or will cause a problem. We're trying to prevent progression. But again, people forget the pain they were in prior to the extraction, and then they think that the extraction's the problem or the dentist is the problem.
Yeah, that's such a clever way of looking at it. That absolutely. Because I work with fears and phobias with my clients and things like that to help them manage their minds. And most people's fears and phobias are not actually the fear or phobia. It's the brain's overgeneralization and association of something that's happened here. It must be this, and it makes that connection. So I totally understand that. So I know you quite well, Amanda, for the couple of times that I've met you. Great conversations. We've had some great one-on-ones. And I did call you out when you first started the podcast because I'm like, that we're not having that voice because that's not Amanda's voice. Amanda's going to show up as Amanda needs to show up for this podcast. So knowing full well why it's such a stressful thing, and I was quite surprised to find out there's quite a lot of you said litigacy or something. What was the word?
Litigation. So litigation.
Litigation. What's the litigations in the dental world then?
So I think the reason for that is you have these firms that will encourage you to go and sue a dentist. And this is for basic complications. With every surgery, there are complications. But when things don't go right, people want to blame someone other than themselves. They want
Where
some
there's a
form of
blame, there's a
compensation.
claim.
Yes, exactly. So they want some form of a compensation. And now, more than ever, you have people advertising that kind of thing. And again, nobody goes into this career wanting to harm people. With every surgery, there are risks,
And
and
it
we
is a
have all.
surgery, I suppose. People might not realize that, but it's a surgery. You're opening up the
Yes,
mouth.
yes, yes, 100%. It's a surgery. And it's not just what we do, but also is the body's immune system that's acting with us to try to prevent the disease. And sometimes we're human beings. No two people are alike. We use the same techniques for everyone, but no two people are alike. We're also counting on the body's immune system to accept what we're doing and help to prevent further progression. But when things don't go as planned, somebody wants someone to accuse, and it might be at no fault of the dentist. But can you imagine the stress that will put on an individual who was trying to alleviate pain?
Mm.
So that's even added. They said about 40% or so of dentists practice what we call defensive dentistry because a lot of things they're just trying to cover their back. A lot of things that we do, we're just trying to cover our back. So if it comes, so you'll have dentists spending 2, 3 hours after the workday trying to write notes of the conversations they've had. Again, further adding to the stresses of the job. Trying to add notes, as much notes as possible. So God forbid something happens in the future, they have that to back them up.
Makes total sense. Now, if there's a blame, there's a claim. I love that concept. Most people will know and hear of. So we've had the conversation because I think it's a powerful conversation. It's the argument of we all know that there's a millions of people a year going to Turkey. They're going to Turkey for turkey teeth, Amanda. And Amanda is here, who's done all her training to the highest of qualifications. She sat there in Perth going, I can do a better job than the people in Perth, but they've got a better social media, or they're doing great social media and they're getting people to go to things. Now, and I will come from the place of cost, not value, cost. How do you explain the value as a dentist of, look, this is what's going to happen if you go to Turkey? We're not slamming Turkey. There is some good practices in Turkey, of which we know. Not every one of them are. How does Amanda say, this is why I'm here waiting to help you get the smile that you need in Perth, not Turkey? What's that conversation, Amanda?
So, what a lot of people don't realize, or what a lot of people don't consider when they choose the option of Turkey, in my opinion, is continuity of care. It takes a very, so I'm meeting Cuddy today. Okay, this is June 16th. I'm meeting Cuddy on this day. What you lack when you go abroad to get dental treatment or healthcare in general is that lack of continuity of care, meaning you don't know what's led Cuddy to his state just today. I rarely ever treat people on the first day I meet them. There are several conversations that need to be had. I need to understand your life pattern. I need to understand your work pattern. I need to understand what's important for you, why that's important, what's led you to this point. Most cosmetic treatment or restorative treatment comes out of that relationship that takes time to build, understanding their pattern, understanding what's important. So I can give you an example of a typical person that would want to go abroad. And maybe that will help you understand. It's someone who's probably neglected their teeth as a result of life. Life happens, things come to the forefront, and that's okay, that's understandable. But it's taken a long time for you to get there. It's not an overnight fix, and that's what Turkey offers. Because
They do.
that's what they offer. If you've taken several years to get to the point where your teeth are broken down, your gums are unhealthy, gum disease does not happen overnight. It progresses over several years of lack of good oral hygiene. If someone takes out all your teeth and puts implants in that mouth that still has that bacteria that causes gum disease, guess what's going to happen in another couple of years? They will all fail. So what we offer, what going to your family dentist or coming to a place like Dental Care Perth, is we understand, we sit with you, we understand how you've gotten to the place that you've gotten to, and we try to stabilize you at that point, basically reducing the amount of, I guess, what you'd call bad bacteria in your mouth, improving your oral hygiene, working with you, teaching you how to take care of what you have before we start anything cosmetic, before we start replacing things, because that takes time. That takes time. And a lot of people want an immediate fix for a problem that has taken 20, 30 odd years to develop. And it just isn't it. Another problem is when you whip out of someone's all their teeth and you replace them with new teeth, the mouth, and I know a lot of people will roll their eyes and not agree, but the mouth is beautiful. What you don't think about is every single time you chew, you don't think about how hard am I going to chew on this before I can swallow it. Your body just knows how many times you chew, how hard you chew, how you understand the different consistencies of food. Your brain just knows, it knows when it's time to swallow, when you have to keep on chewing multiple times. Like these are things that we don't think about. It's a system that works. This is how when you get a feeling that's too high, you don't quite know why, but your body knows because everything works harmoniously together.
Mm.
Even when you grind your teeth down, again, it happens gradually. Your brain has had time to adjust. It is incredibly difficult to replicate what was in your mouth. It takes it takes a lot of time for your joints and that entire system to adjust. If you do that overnight, you're setting people up for failure. You're setting the joint up for what we call temporomandibular diseases. And they're incredibly challenging to fix. And people don't consider all of these things because at the end of the day, they're looking at cost. And yes, it's more expensive, but it's more expensive because you're not just paying for that fix, you're paying for the time it takes to rehabilitate you to a place that you are stable and to continue, then to maintain that stability for the rest of your life.
And I think I don't know about your prices, so we don't have, but I will talk about the experience that I've had because it is cost. It is a cost. I think generally in Turkey, all in, it's 8 grand for your teeth. Let's say, as far as I understand, I've been quoted about £8,000, uppers, lowers, everything. And I think when I was talking to a place in Edinburgh about 4 or 5 years ago, they weren't going to do a full implant. They were just going to give me some back teeth here and a couple of teeth here, and it was going to be about £22,000.
Mhm.
And I was like, holy shit, that's just un. So obviously, as somebody, I'm not the richest in the world. I know I need to do something with my teeth and things like that, but I'm just like, obviously that the option's gonna be to have a look at the Turkey option. Or I think it was Poland that was that there was a lot of great dentists in Poland at one point. But I remember the conversation that you had, and I was like, that's what put me off. And you weren't actually slamming Dubai or Poland or any of these places that you were actually look. A lot of the dentists around the world are not in the Dentistry Association, which keeps you covered. And that's kind of why you're better off going through this line more than flying to Turkey or Poland. What was the commission that you are a part of?
Okay, so no, I think maybe there was some form of misunderstanding. So what it is in the UK to be a dentist, we're part
Yep.
of the General Dental Council, so it's called GDC. And to be a dentist, we're part of that. Pretty much what the GDC does is that it regulates dental treatment. It basically says this is the standard, and you need to meet that standard or be above that standard to practice dentistry within the UK, or you risk losing your license that you've worked hard and spent a lot of time getting. What I'm saying is, if you go, well, this is my point. The people, it's very, for the people who advertise for international patients, there's tons of people. So look at it this way, there's tons of people in Turkey, there's tons of people in Poland. Why would I need to advertise for internationals? There's why, what type of practice would need to advertise for more international people to come? If you were practicing, this is my argument, I'm not advertising for people from Poland to come to the UK to come and see me. There's tons of people within the UK that need dental treatment. What I'm saying is that the dentists who, in my any dentist that's worth their fee will have already the population within their population that they're taking care of. And those are not the ones that are advertising. The ones that advertise for international people to come in just treat international people at this standard rate. And they're not, in my opinion, they're not going to be held to the same level of accountability because guess what? You're going to go back to your country. And
Yeah,
how often would you go back to whatever country it is that you're
yeah.
going to go and get the follow-up care, to go and, if something goes wrong, who do you turn to? I've dealt with cases where they've gone and got multiple implants in a foreign country, they've come back in, they have abscesses, and then they have abscesses, they have several complications that need taken care of. Guess what they're not going to do overnight is book a ticket, last minute ticket to whatever country. People don't consider this.
And
Um,
are you allowed to? So like because I think it's a great conversation to have, especially with mental health and stresses for dentists in the UK being so high. This would be a part of their stresses. Is like, how do we make that comparison? Are you allowed as a dentist, if I go to Turkey on Monday and I come and see you on Friday, oh, can you have a look at this? Are you like, no, I can't touch it. It's not my work. I'm not. How does that work?
so you can do. The problem is if you go and get a full amount of implants, you've entered specialist territory. Do you understand? It's not an easy fix. You will now require someone who has done several courses within that field. You have to understand that an implant is a titanium screw that literally goes into your bone and fuses with your bone.
Yeah, yeah.
It is not. It's not a joke. So you
No.
need someone to either remove that in the process, also possibly removing some of your bone tissue to fix that, or you will need someone to fix the bite that they have, that they have completely reorganized to something that is comfortable for your joints, which is incredibly complex work. Who is going to foot that bill? It's not going to be the NHS. So again, they will then charge you. So, like you've said, your option was to go to, I don't know if you said it was Turkey or Poland, and get everything taken out, new set. Whereas a dentist in Scotland was offering you, I'm going to add back teeth, what you're actually missing, and leave the front teeth that are still healthy. Can you see the different mindset as well with that? Because we know as dentists that there's nothing as good as the teeth that you have. And
Yeah, yeah, that's
that,
yeah.
if we can preserve that, that's more important than giving you a new set of Hollywood teeth. So it's even like just a difference in mindset between those two things. And that's what we're held accountable for that. Because every single time I take out a tooth, I have to justify it. I have to justify why I've done that and why, the patient and I came to that agreement that taking out a tooth that could have been saved or was healthy was the best option. Whereas you go to these foreign countries and you just say, I'm unhappy with my smile. Guess what? If you're unhappy with your smile, there's several options. You can have braces to align your teeth. But guess what? That takes time. You're not going to go to a foreign country every month, like you said in your case, to get your teeth straightened. You're not going to do that. You want the quickest option. And the quickest option in dentistry, majority of the time, is not the best option.
Wow. Thank you, Amanda. Seriously, thank you. I think it's the conversations that need to happen because there is that let's fly out. And I've seen, so I've got a few friends that have been flown out of Turkey, and they keep having to go back to Turkey every 4 months. They're like, oh, I've got a tooth, I've got to go back to Turkey. And I'm like, that must be annoying as hell. And they went, I but I got the teeth done in Turkey. And why is it that people's teeth generally don't seem to suit them? The amount of people I've seen with, you can see the turkey teeth, right? You can genuinely, because that was one of my things is I can't go to turkey, I can't come back with turkey teeth. I actually don't even want super white teeth because I've never really had super white teeth. So I can't have that process of going and getting my teeth done because I kind of want them to just look like that, but full teeth. I don't want. Why is it there is that? You can just tell turkey teeth. What is it about it, Amanda?
So let me tell you, maybe it'll be easier if I tell you my process.
Love it.
If a patient comes into the practice and they say to me, I hate my teeth, I want a new smile. I will generally have a conversation with them at least 3 times before I even do anything. Again, I'm trying to find out where their mental health is at because sometimes it's just body dysmorphia. What I see versus what they see is completely different. And I'm trying to source out because sometimes fixing your teeth will not fix body dysmorphia. So what I'm trying to do is also analyze where their mental health is at if we're a perfect pair because guess what, once you touch a patient you enter what's called the restorative cycle. You know that we know that not your teeth are made to last till you're 150. Our restorations, a really good restoration, you're looking at 10 to 15 years. So,
So, wow.
so people, this is what people don't consider when they go to Turkey, when they say, whip all my teeth and let's do this. You're going to be going back over and over again. It needs maintenance, it needs changing. So I have that conversation and I inform them of this. And I have that conversation multiple times. We document that. And then what I do that a lot of people will probably not even consider doing is I do what we call a trial smile, where I send them a copy of a 3D smile, what their teeth will look like after. But then I also get them into practice. And then I put that trial smile into their mouth. And I say to them, go show your friends, go show your enemies, go show your family, go show everybody. But try that in your mouth. I want to hear the good, the bad, the ugly, because at this stage, I've not touched you. I've not done anything that is irreversible. Take tons of photos, post it on social media, see how you feel, see how your bite feels. I'm also checking their bite, making sure that their joints can adapt to that. But guess what? That's time. If you're going on a 5-day trip to Turkey, you don't have that luxury. But I'm checking to see how their biology adapts to it, but also how their physicality adapts, because that's a massive change. People have seen you one way for several years, and now I'm about to go and do something about that. And then when I now get that final, and I let them do that for a couple of weeks. So it's not just a day, go away for a week, come back, pink it right off. It's easy, it's quick. If they then say yes to me, I then will proceed with, okay, we're going to book the appointment. This is the process. This is what you're saying yes to. This is the lifespan, and this is the cost of it. most practices these days will offer finance options. So it's not a one and done. Like, for example, our practice offers 0% interest for the first year and low interest finance for up to 4 years. So I've had several people that will spread that over several years and then come and get it done. And guess what? Everything is under warranty for a year, and I'm here as their dentist to maintain everything because I know what's been done. I've done it to the standard that the dental council expects of me and the patient expects of me. But we've also had those several appointments to build that rapport, to build that trust, to build that accountability that is necessary to do treatment at the highest standard.
Yeah. Wow. It is a complete mindset shift, isn't it? It's completely a mindset shift for people. Do you think? No, I'm not going to ask that question. I was going to ask. No, that was a leading question, and I'm not going to go. You're far too smart for that, so I'm definitely not. No, because it's. There's always that. I suppose because one of the biggest things that we'll talk about this as well is when you're getting veneers. I've seen a lot of like young people getting the veneers, which means they file down the teeth underneath and then they put on the teeth on the top. That to me seems worse than getting implants because you're filing down good teeth for a plastic set to go on the top. What's that all about?
So, no. I think implants are worse because
Right.
you take out your teeth. So implants, for you to get an implant, you have to take out your teeth, and that's no tooth. No tooth is worse than some form of tooth. Um, there is a place and a time for veneers. I think the problem is people want, again, it goes back to that quick fix. A lot of times your teeth are not the problem. It might be the alignment of your teeth that's the issue that you're having. And a simple set of aligners or braces to straighten it all out could give you the same results as veneers will. So it's not necessarily. But then you have the select few where their teeth were just naturally discolored, the shape of them, the patient, I have people have small teeth, large teeth, they just need some wrinkletouring. Yes, in those cases, veneers could be the option. And then we have different types of veneers. We have the plastic ones you're talking about, which are composite veneers, what we call, and it's all the rage now. Everyone wants perfectly symmetrical square teeth. I, as a dentist, I hate that. I don't do that kind of work because I don't want someone seeing it and saying that's Amanda's work. I don't want to put my name on that. And there's some dentists who love that will do that. And that's why that initial conversation, again, is really good because what I do is I do the mock up and I say, that's what I'm willing to do. That's what I can do for you. If that's not what you have in mind, that's good. You can go and find someone else that will, because there's always going to be that one person that's willing to do what a patient wants. But then you have the porcelain veneers. Those are made of porcelain. Those are higher end significantly. It's almost a 3-4 times cost difference between the composite, the acrylic ones versus the porcelain ones. Those are bespoke. They're made in a lab. They're made to fit the shape and of the patient's face, and they cost a lot more because they're a lot more labor intensive. And the longevity of that is the acrylic ones or the plastic ones usually last between 3 to 5 years, whereas the ceramic ones upwards of 15 years. So again, that's what you're paying for. But it goes back to the mindset. Do you want the quick fix, or do you want something that's going to last? And is your choice what is actually best for you? And I think it's up to the dentist to have that conversation with you so that you know what you're saying yes to. There will always be someone who says, I can't afford what's best, and that's okay as long as you know what you're saying yes to. But I definitely think there is a time and a place for porcelain veneers. But I always feel that it shouldn't be, or veneers generally, but I feel like it should not be in the place of your own natural teeth, especially when your natural teeth can be saved.
Wow. Fascinating conversation, by the way, especially teeth. No, fascinating conversation. So I've got a question.
Mhm.
How do you find, or what do you do to make yourself mentally healthy? Because Amanda seems to own her shit. She is all over it. She's not one of those dentists that's trying to take a life or isn't maybe offended when somebody comes and goes, I don't like you because you're going to hurt me. How does Amanda manage her mind?
That's good. That's a good question. In all honesty, some days are better than others.
Mhm.
Always. I could tell you probably one of my one of my lowest days. One of the reasons, because I'm sure everyone could tell I'm not Scottish, but one of the
Yeah.
reasons that I was drawn to Scotland is because Scotland has a lifelong registration. Once you see a patient, if they like you, you like them, they're yours for as long as they'll have you. And I love that because I wanted to see families grow. I wanted to see my patients grow. I wanted to see my patients evolve. I had a patient who'd come in and I was treating him and his wife, and lovely couple. Everyone knows that if I ever got in trouble at work, it was because I stayed too late for a patient who was a romantic. I love love. I would, if a bride comes in and says she has a wedding in a week, I'm that dentist that would go begging, can I stay late just so I can treat them? I love love. I'm a hopeless romantic. And I would see him with his wife every single time. And he was my first patient of the day. And I noticed that he was coming without her. And he'd informed me that she'd passed away a few weeks prior to that appointment. And I just cried. I'd cried in the surgery, and the appointment ran late. The second patient came in. They were upset that I had made them late for work. I can't tell them because there's a confidentiality. They'd seen
Yeah.
him walk out. I can't tell them what's gone on. I go out, wipe my tears, exhale, inhale, back, game on. And then 3 patients later, it was an emergency and they were incredibly rude. Incredibly. There was no accountability on that part, on their part. It was just, it was all me, it was all me, it was all me, and I needed to fix their problem. Again, I'd been running late from the morning, and you come back, you come into that, you inhale, exhale, and you just keep on pushing. And I remember getting home that day and I just fell on the floor and I just cried for a little bit because you have to hold that in. They don't care that the first patient had that emotional trauma that was then given to you to help carry their burden. Because they trust you, you've built that relationship with them. They don't care. You have to be at your A game every single time. So back to your question, it's just that was just so that you can understand how a day
Yeah.
can spiral very easily from the
Yeah.
perfect day to that. Um, how do I handle it? I have a good team. I was really intentional. Clyde Monroe has been really good to me. Dental Care Perth has been really good to me, so that's where I work. I was really intentional about the team that I work for, the team that I work with. They've been great. They're experienced. Um, any nurse that I work with, any nurse that is within my practice will happily stay late for a patient. They will take out of their personal time and they prioritize. We run into lunch sometimes because sometimes I always joke, teeth don't do what teeth are supposed to do. So sometimes you run into lunch, sometimes you work late. Any nurse that I work with will happily stay late and put the patient first. It's not always what's best, and I don't try to. I appreciate their time, so I don't make a habit of it. But things happen, and they understand that, and that helps. That helps just with the load at the time. I have a really good team. That helps. I have a lot of activities outside of work. I do art on a Friday, and that helps me switch my mind off. Um,
Is that your art in the background?
No, but I have some all around that is mine, but this particular one's no. But I do art, I sculpt as well. Again, it's mentally intensive, so it switches my brain off. And I have those techniques. I go hiking, I go on long walks. Again, all of that helps to switch my mind off. And building a relationship, and I know I've talked about this, touched on this, building a relationship, building rapport with your patients as well, reduces that risk of litigation because they honestly know where your head is at, that it's not about necessarily about the finances, but it's about having their best interest at heart. And that helps. And that's one thing that Scotland does, right? Because if I'm seeing the same person over and over again, we know each other. We've built that rapport, we've built that relationship. They know that I care. And then you work from that understanding that at the very core, Amanda's here to help me. If if things go wrong, Amanda's here. Another thing that I think my practice does well, is that we see people within 24 hours of pain. So we'll try to get you in. If you called us at 8 in the morning, we try to get you in the same day to
You're
sort.
private. It's not NHS, right?
We also have an NHS contract. So we
Nice.
also so this is across the board to all
Nice.
there is no exception. Yes, we have a high number of private patients, but this is across the board. And this was a decision that we made as a practice that anybody who calls at 8 o'clock, we'll try to get them in the same day by 11. And if we're so busy, so full, and which is on the very, very rare chance, they will get priority appointments the next morning.
Yeah.
So we are not leaving our patients out there neglected in pain. And we see them often. We see them often enough. We see them on a recall system so that we're not even getting to that point where we have several patients running up and down in pain in the country. So that's what we do. And all of these steps help to mitigate that litigation. All of these steps help to build rapport, help to let them know that we have their best interests at heart. It's not easy. It's not easy. You have a mixed bag of a population. You have people with different traumas, different levels of phobias that we have to deal with, we have to manage. But when we understand that, we can make allowances for that and we can give them the time that they need so that we can give them the best care possible. Sometimes it is at no financial benefit because there is no button that you can click saying, do you know what, this person needs an hour more under the NHS. That doesn't exist.
Yeah.
But you have to make that allowance so that you can give them the care that they need so that they can go out and thrive.
Yeah. I will share before we wrap up, because I know you've got another appointment to go to as well. I will actually say that I worked for Royal Caribbean, so I had to go to dentists all over the world. And one of the actual best places that I went to was actually Cozumel in Mexico.
What did they do?
A small island in Mexico, and it was actually one of the best dentists, quite cleanest, tidiest, all the tech, all the mod cons. And bearing in mind, I'd seen most people's teeth in Mexico. I was really surprised that their dentist was that good. So it must have been for the high flyers that went in there. But Royal Caribbean had a contract saying, look, if you've got a problem with dentist, you've got to go and see this one in Cozumel. So I can't possibly talk about Turkey or Poland. But what I can say from what I've learned and understand, Amanda in Perth is excellent, and so is Cozumel.
And I think every country will have excellent dentists. I always say to people, and this is just, I guess, to wrap up, I always say to people, if you're going to a dentist in a foreign country, educate yourself. I'm not saying don't go, don't do it. Educate yourself and go to someone that's a local would go to. Don't go to the people that are advertising for international patients.
Yeah.
Go to somebody that a local would go to, someone that if you have a local friend, so if you go to Poland and you have a Polish friend and she says, you know what, I go to this dentist, I'm really happy, and you look at her smile and you like it, go to that dentist. Don't go to someone that's promising you dreams online because you know what, you want someone that your friend can go say, do you know what, you screwed up my friend's teeth and now she's in England and having pain, and then he can go smack that dentist. That's the one you want to go to.
Amanda, what a fascinating conversation. It is factual that there is a very high suicide rate in dentistry. I thought it was a joke for the movie. I thought it was like an ongoing joke, but when I spoke to you, I was like, no, actually, there's a really high suicide rate in dentistry. And understanding why is a powerful thing. But as we always say on the podcast, if it's in the mind, it can be managed, and there's always a solution. We find ourselves wrapped up in problems and challenges. We can struggle to find a solution sometimes. And that's what this podcast is all about, is bringing those solutions to help people move forward in life. Amanda, is there anything else you would like to share in the world?
Yes, I think just 2 phone numbers. So if you're a dentist out there and you by chance listen to this, and you have issues and you're struggling mentally, the Kenmore Trust is really good at that, and their number is 85258, and the Samaritans as well, 116123. And if you reach out, they'll be more than happy to help and have that conversation. But you're not alone. I know it's a really solitary career, but you're not alone. We all go through it. We all have our low moments. Speak to somebody, and I hope that wherever you're working, there are people that you trust enough to speak to, because you all care.
Perfect. And they can always get in contact with Cuddy Cudworth, the UK's leading mind management coach. Okay. It has been an absolute pleasure, Amanda. You light up a room with your smile, and that is clearly because you've got a good dentistry around you. And well done for changing the persona from "Hi, I'm Amanda Duke and welcome to the podcast" to "Hi, I'm Amanda Duke. I'm in charge of things." Well done for changing that. As always, big love from Cuddy, and we'll see you on the next episode of the Mind Management Mentors podcast.
Thank you.